You walk too far.
Just so everybody knows, this is we're not admitting the public, but Dan was on, and Kayla were on the agenda for a long time, and so this small group of people, it has to be on the agenda at the beginning of the month, so because we're under the number that is allowed, hopefully. That's why they're here, and the rest of the public is not gonna be in because of the virus rules, so, I will call the meeting to order, but I'll have to turn just, one second. If anybody knows more about this than I do.
Town nurse camera. Let's all turn our back to it. Almost all.
I don't, I'm being careful.
I hope it's on. If it shows a picture, it should be on. It's green. I'll be in trouble. I pledge allegiance to the flag
of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right, you barely made it up there. You barely made it. I have only two adjustments to the agenda. They're I under new business, a zoning law committee I want to talk about, and J, I want to talk about our Verizon account, Pitney Bowes, and Frontier, just briefly. Those are the only adjustments to the agenda. This is Dan Miller from Sprague Insurance, and Kayla Wagner, also from Sprague Insurance, and Dan is here to talk to us about our health insurance policy and the fact that he can save us a lot of money for the exact same coverage we have now.
The other component is the dental insurance.
Right.
Thank you.
So, good evening, everyone. Thank you for having Sprague Insurance. We appreciate the opportunity to continue our partnership. We've been working with you for a number of years on a number of the insurances. We're one of the leading insurance broker providers in the Southern Tier, and we have been going on 100 years, so we're proud of that. Tonight, I'd like to draw your attention to the second, the left side of the folder out of the gate here. I'll pull those two documents out. I'll start with the back of the two documents, which has, it's a big document. It looks like this. Okay, so in working with Supervisor Hall, we took your current dental program, which is with Shelter Point right now as the carrier that adjudicates the program, and we took it to the marketplace and looked at all of the carriers that have strong networks in this area from a dentist perspective. And you'll see the findings are very telling. We're pretty much consistent with savings across the board of 50% for the enrolled employees in total there. So, you know, taking the shared same contract, 100% coverage for all your preventative services, right? And everything kind of aligns relative to the annual maximum and how things are set up today. And the savings it cuts your costs in half across the board. You know, so how do you choose? You know, we have a long-standing relationship with Guardian, and I think if you were to ask our recommendation, we would say let's pursue the Guardian dental program. for a couple reasons. I think they have the strongest network in this community and in the southern tier, which is key. And they are also the least expensive, and that just happens to be the case. And we don't always recommend the least expensive, but in this scenario, it falls into that category. So it cuts the annual premium spend. In this, I did not break out employee dollars and town dollars on this, in this model. But it cuts it from $13,726 a year on the dental program to $6,134, no changes in coverage, and frankly, it'll be a better experience for the consumers and for the employees because Guardian's a much better carrier to work with than Shelter Point as it pertains to dental insurance. The bottom component is a basic life AD&D summary. We did that proactively. That is not a requirement to offer the employees. We felt that just with the fact that we were gonna free up $6,000, you know, might not consider taking 1,000 of that 6,000 and adding an additional benefit, a nice death benefit, a final expense benefit of $25,000 for the employees of the town. And you know, not a huge expense, and could create a nice added perk as a result of being employed here. Not a requirement, just something, food for thought, something to consider, and I wanted you guys to be aware of what the numbers were for that type of program. Any questions on the dental or the life insurance concerns?
I'll just add that we have been having some issues with Shelter Point. One of the highway employees, his wife had the coverage and they denied her claim, and that went on for a couple months, and then in January, I got involved and I did send a letter and we got that straightened out and they did pay it. And then 2 weeks ago, one of the other highway employees went to the dentist, had his teeth cleaned, and when he got to the checkout, they said, oh, we don't take that insurance anymore because they haven't been paying. So there are some issues with them besides double the cost.
The next steps would be Supervisor Hall and I would fill out a couple of paper documents and together from an admin perspective, we'd submit to the carrier the current enrollment of our 8 folks that are on the plan today would not be required to do anything. They would be census enrolled, and we already have the data that we need in order to move them from Shelter Point to Guardian, as an example, if that's the carrier we decide to choose. Any other questions or comments on that?
No question.
Do we want to make a motion to make the change tonight, and you and I work together to take the necessary action steps? You know, with timing, the date in which we have this be effective can be any time we want. We have the control of that. A few things going on right now, right? So, you know, we're conscious of that, and so, you know, we can really kind of figure out what makes sense for everyone in terms of any type of transition.
Judy, did you happen to check on any of the network ones to see if the people that our employees use are in there? I I mean, if I've been with somebody for 30, 40 years and then all of a sudden I'm changing,
Yeah, we had talked about that.
and so do you know if those dentals that we use now are in this network? So those people wouldn't have any trouble.
So what we can do, we can certainly obtain the dentists that these, 8 folks go to. Which is a little bit of recon, pulling, asking the question, who do you go to today, and we can double check that. The answer is a high probability of yes, but I cannot confirm with certainty, as we have not lifted the hood on that and drilled down specific providers yet.
But you did check, like, there's some in Naples and Dansville and
Yes.
that close.
Yes.
Yeah, I had
Okay.
told him that what towns would
Okay,
have dentists
all right.
around
Yeah.
us too.
Yep, and it's a 90th percentile UCR, which is usual and customary, which means that regardless if they are a provider or not, they can obtain services, and there's only a 10% balance they'll do in the event it's a non-network provider.
Okay.
So it's a very rich contract as opposed to the maximum allowable charge setup, which is oftentimes seen in the marketplace too, which is just you have to pay whatever the provider tells you to pay.
Right.
So that's a positive. But we can take the next step, if you would like us to determine who is going to who, and are they covered as an in-network
Well, as long as you
provider.
check to make sure there's some right around here that they can go to, that they have that choice, like in Dansville and Naples.
And thus, that's why Guardian was more of a recommendation as
Okay.
opposed to some of the others we looked at.
Okay.
I would second your motion that you asked for.
I don't have.
Well, you made a motion that they,
It was more of asking if we should.
well, however,
Thank you.
Thank you.
you're welcome.
I'll make a motion that we, change carriers to Guardian for dental insurance for the employees.
I'll second it.
Any further discussion? All in favor?
Aye.
Opposed? Carried.
Next, the bigger ticket item is the health insurance. It would reflect this document here, on Ledger. So, there are, based on the size of the town, you're in this community rated space, boxed into certain plans, right? And, the current setup, and we have very little information on it, and it's with a local 71 union, which was out of Rochester and is now, as far as we can tell, is administered out of Anchorage, Alaska. And so, regardless of that, the insurance is operating well. We haven't heard any issues as it pertains to the current insurance on the health plan. But there is a plan that we can utilize with the same carrier, okay, which is Excellus Blue Cross Blue Shield, the same network, so there wouldn't be any disruption or anything as it pertains to folks that have been going to their doctors and have their primaries already set up, nothing like that. What this does is it keeps more money in the town's pocket on the front end, because we cut the premium by $42,000 in terms of the payment on an annual basis to the insurance company. All right, so that's part one. Part two is we take that savings and we utilize what's called a health reimbursement account. And what that does is that health reimbursement account funds for all co-pays. It helps employees fund for any deductible expenses as it relates to this plan, okay? Because it is a plan change from your Cadillac copay, everything is covered after the copay is paid by the member, to a deductible plan. And so rather than the employee pay the deductible, then everything is covered in full, we utilize a deductible, and then everything is covered in full, and we backfill and we protect the employees with the deductible expense or the risk. We protect that with what's called a health reimbursement account, and the employees have a credit card for any medical expenses. They utilize that credit card for that expense. So what does that do and what does that mean? that essentially allows you as a town to self-insure your claims, okay? You're too small to go onto a self-insured plan, but this is a self-insured model. So it allows you to spend the least amount of money on the front end, keep the money in the town's budget and keep the money in the town's account, and then we link a third-party administrator called ProFlex, which is the health reimbursement account administrator, okay, that pays the providers, that administers the credit card, okay, to pay for the expenses as utilization occurs throughout the year. What we know and what we see with over 70 public entities, towns, villages, and cities that we work with, we know that the utilization is around 20 to 25% of what the actual deductibles, if you sum up the deductibles, what that is. All right, so how does that play out from the numbers, right? So that's what this document is, all right? So that high level, we're creating a self-insured model with a fully insured health plan with the same medical provider, Excellus, Blue Cross Blue Shield. You pay the least amount of money to the provider, to the insurance company, and then you utilize a health reimbursement account to pay for the deductible expenses as it relates to the actual employee's risk. So the employee is actually less, there's less expense on their end as it pertains to the copay, because if they have a copay, they pay for it with the HRA credit card. So what that means from you break it right down, and there's a lot of numbers on here, so I'll try to keep them clear and crisp here. So your single, all right, reduces $49 a month, okay? Your subscriber plus spouse plan, now this is their 25% portion, right? This is the employee's portion, will reduce by $99.88, all right? The employees, it'll reduce by $84.90 for subscriber plus children per month. And then family will reduce $142 per month savings. That's the employee's 25% portion. The town, their portion, and I just draw your attention to the far right, the town's 75% portion will reduce from $105,791 to the insurance company. It will reduce to $74,239, resulting in $31,552 of savings for the town on the front end. Now that is not the raw savings, because there will be utilization of the health insurance, and you want to continue to be paternalistic for your employees because you want to maintain and retain and attract great people, and you are a very strong town and have obviously been doing that for a long time with your current plan. So that's where the HRA comes in, and we backfill or we fund the HRA with that savings on the front end, all right? And again, the utilization will pull out of that money. So if we use one example, I put 25%, which is on the high end of what actually gets seen here, okay? The total spend on the HRA is $28,688. That's 25% of the total deductible risk. The total deductible risk, right, is $13,500 per family, and then $6,750 per individual. So you just sum that up with a 25% figure, right? I summed that spend, if we did the 25%, to what your $74,000 spend to the insurance carrier would be, which is $102,927. Obviously less the $105 that you're paying today, you come up with almost a $3,000 savings for the town. And that does not include the $10,500 savings of employee payroll deductions that we resulted there too. So your actual savings net together is about $13,000 for using 25%.
I'd like to say this.
Me too.
So we have a lot of experience with this, and I have one other example. This is a town right down the road from you, and we have a full year of experience with this particular town. Where did I put it? Oh, there it is. All right, So town right down the road, they're a little larger. They had 16 members on their plan as opposed to